the room. Sorry, Sarah. Just get right to the back, and then it's going to be somebody at the front. Okay, good. The lady with the glasses on top of her head. Hello. Right, and next question. How to use a microphone? Nice and close to the mouth. Not down here because it doesn't work. So nice and close. Okay? Everybody does it. You're not the only one. But as soon as you did that, I thought, oh, I haven't said that as well as. So you will understand that I've got a gentleman in the spirit world that is coming through and saying he's dad. You understand that dad has passed first?
Yes.
Okay. And you also understand that he would have passed very quickly with his chest?
Yes.
Okay. And do you understand either William or Walter with him, or the name William or Walter? Doesn't have to be his name, remember, but it's just a name that's been popped into my mind.
Probably William.
Right, okay. And would it be Bill, can I ask, more than William?
Yes.
Okay. Okay. Right. And he would have been a smoker as well, wouldn't he? Well, can you understand the tobacco smell that I'm getting that's coming around? I have actually got two gentlemen with me. There's another one that's older. I feel like he's got more of the smoking. Do you understand the smoking with, that would be Grandad, so Dad's dad?
Yes, Grandad.
Yeah, and you understand the smoking with him, don't you?
Yes.
Okay. Okay. And is that where Walter comes in? Because that's Walter's just popped in again.
I think Walter was one of his friends.
Right, okay. I know we've just got a few gentlemen here all wanting to speak at the same time, so I'm just asking them to just try and separate a little bit. Okay. And their passing's quite a long time ago. It's not a recent passing at all, because I feel like I'm going back. And I want to say possibly near the millennium with one of them.
No, it was 2013.
Right, okay. So why are they giving me the millennium? You don't understand the millennium with one of these?
No.
Okay. Can I ask, Grandad, was his stomach related? Because they're just giving me lots of pain in my stomach.
No.
So there's somebody else here that's around the 2000 that would be stomach related, as well as, and I do feel as if I'm still with you. Don't worry, because they're just saying don't worry. I just want to give them a message. The reason why they're giving me this is because it's giving me the thoughts of there's somebody living that has a problem with this area at the moment. You understand this? So somebody alive, not past.
No, I can't think of anybody.
You don't know anybody that's feeling nauseous at the moment?
Probably Sue.
Okay, because
Sat next to me.
Right. So are you feeling nauseous, can I ask? Because I've just got the thoughts of there's somebody living that's feeling nauseous, and the thoughts of some tests that needs to be done. Right, okay. Can I ask, I feel like I'm speaking with Bill again, was he somebody that was quite dry sense of humour, like to have a laugh?
Can't think of, no.
Sorry, I think it's me.
You understand some of this?
I know, yeah, all of it.
All of it?
Yeah.
So can you understand the stomach here?
Yeah.
Right, because when you said no to that, he was like, no, that's not right, there's something wrong here. And somebody going backwards and forwards having tests done, isn't there?
I've got an appointment, yeah.
Right, okay, can I just really hear your voice?
Better?
That's better. Okay. Why did it take you so long?
Well, my dad, Bill, he died of lung cancer.
Okay.
My husband's name is Wal.
Okay.
Dry sense of humour, definitely.
Right, okay. There's one thing I forgot to say as I started, and it's quite important. I do say things as it is. I don't mince my words.
Yep.
So if your spirit communicators were like that, it's just going to come straight out. So
Yeah,
please don't shoot the messenger, is what I'm going to say.
No, you're right.
Right. Okay, so you understand, is there somebody around you that's wanting to stop smoking, can I ask?
I've just stopped smoking.
Because I just got congratulations on stopping smoking, and I just thought it was like there was
3
talking about.
weeks, yeah,
Oh,
3 weeks.
I got that slightly out then, because I thought there was talking about doing it. It was a congratulations on thinking of doing it, but you've
No,
done it.
I've done it.
Perfect. Because I'm getting the thoughts of they don't want the same things to happen.
Yeah.
Yeah. Okay. And you do understand that towards the very end of their life, they would have gone downhill very quickly.
Yes.
Okay, that feels better. Thank you for working with me, but this does feel better. Okay.
Yeah, it was a matter of months.
Yeah. Is there a trip to Scotland with you, or can you understand why they're taking me up to Scotland?
No.
So you've got no trip to Scotland planned?
No.
Okay.
Wrong way.
Inverness is Scotland. I keep getting Inverness like up on the. I keep getting the thoughts of Inverness. You don't understand that. Okay. Well, they'll give me it for a reason. So.
My sister goes up there.
Right. Okay. I was going to say they always give it for a reason. I've
Yeah.
just got to work it out why.
Yeah, yeah.
You know, earlier I said, well, I'm going to say it as it is.
Yeah.
Okay.
Yeah.
I get the thoughts of there's somebody around yourself
Okay.
that is possibly.
Say it how it is.
I'm just checking who you're with, because sometimes I put my foot in it.
It's all right.
I'm okay. There's somebody around you that is taking advantage of you, and you've got to say no.
Yeah,
Yeah.
we know exactly what that is. Yeah.
Right, okay, because that's why I just wanted to check who was around you first.
No,
I've
it's
got
fine.
no, we're okay, I can say it.
Yeah.
But there's somebody that's taking advantage of you, you've got to say no. You can't let them do it any longer, it's too much now.
Okay.
Okay. And also, I can see you're wearing glasses, but can you understand the squint or something with your left eye?
Yes. Yeah.
Can you get that looked at, please?
Yeah. It's been looked at before. Yeah.
Right, okay, just got the thoughts of squinting, tingling. It's like
Yeah.
a tingling sensation in
Yeah.
here.
I get it. Yeah.
Yeah,
Yeah.
and it's that I felt as if there was something that can be done. Obviously, your relatives aren't doctors, I'm not a doctor, but it's given me the feeling there's something that can be done with that. So it doesn't feel like you need to put up with it.
Okay.
Okay, right. Okay, and can you also understand, now they're giving me Scotland again, so if you don't understand Scotland now, there's Scotland that's coming in, because they're giving me it again.
Okay.
So if they give it me again, it doesn't mean that we've got it right the first time, so I don't feel like we're connected with your sister, it feels like it's more connected with you, so look out for that, please.
Okay.
Right. You're not with your husband, are you?
No.
Can you understand that sometimes you're spending a bit too much money, and I ask what you're spending money on, and I just got
Yes.
I just got the thoughts that it's things that you don't need, and I'm like, well, that's debatable because we don't know if we need things or not. We're females, and we don't know if we need it or not until we've got it, do we?
Oh yeah. Yeah.
Okay.
I know where that's coming from.
Right. Okay. It's just giving me the thoughts of cut back a little bit. You understand that?
Yeah.
Okay, good. Right. Do you get your nails done?
My daughter-in-law is a nail technician, so sometimes they need doing. They desperately need doing.
I've just got the thoughts of getting your nails done.
Yeah, I'm supposed to be doing it next week.
Right. Okay. That's okay. Apparently that's okay. You can have that done. There's other things that you don't need.
Yeah, it's because I don't pay for it.
Possibly. There's, he keeps making me aware of my leg, and I feel like it's connected to him rather than yourself. There's something going on with the top part of their leg.
It's my husband.
As your husband, I
Yeah,
just
he's waiting for
felt
a hip replacement.
Right, okay, I just felt as if it was male, so I thought it was connected to him. Okay. He does like attention, he does like me getting this communication, but he could be speaking all night if I don't ask him to take a
Oh,
step
absolutely, that's down to a T.
back. Yeah, so
Yeah.
I'm asking him now to take a step back
That's
so
fine, thank you very
lots of
much.
these other lovely people could get messages.
Yeah,
Okay, but
absolutely,
thank you
thank
ever so
you.
much for working with me.
Thank you.
Thank you.